I'm Dr. Alicia Armitstead, and in my office, the whole point of healing is to get rid of toxins, and with the right nutrition, the body can heal itself. Whether I'm helping someone with migraines, lose weight, digestion issues, or infertility, the goal is always the same: detox and support the body. The reason it's so important to detox is that toxins run throughout the body, creating inflammation that eventually leads to disease. Inflammation in the head is a migraine, inflammation in the intestines, bloating and gas, inflammation in the hormonal organs is infertility. All disease starts with inflammation. In fact, if you have a symptom, you have inflammation. It's that black and white. Many patients come to me after going doctor to doctor with no answers when someone's finally willing to try muscle testing. The reason they go from doctor to doctor and they don't really get any answers is because the Western medicine is looking for a disease. And if the patient's symptoms don't actually fit a disease, then there's nothing that they can do for them. There's no particular medicine. That's how the model works. Yet is the key word. There's no disease yet. Because give it a year, 5 years, even 10 years, and eventually the symptoms will turn into something bad enough to fit a disease model. Um, a good example would be like just a regular stomach ache and bloating. You've been complaining about it for 2 years. You've gone to the gastroenterologist. You've done all the tests, and they don't see anything wrong. And, you know, give it another year, and eventually it will turn into an ulcer. And then they can give you antibiotics to help kill the H. pylori, and they can give you an antacid. So now all of a sudden you have two medications. And the idea is, or the goal really is not to wait until it's worse. It's really to help with the function of the body so it doesn't become something more. When I look at the Western medicine, I look at the medical model, it's outdated and it can depend too much on drugs. And in thinking about like, when did this all start? In the 1900s, actually, in the early 1900s with John D. Rockefeller. He was the first American billionaire, and he bought a German pharmaceutical company that would later actually assist Hitler in manufacturing chemicals and poisons for war. Rockefeller wanted to eliminate all the competitors of Western medicine, so he submitted a report to Congress declaring that there were too many doctors, too many medical schools in America, and that all natural healing modalities were unscientific quackery. Rockefeller called for the standardization of medical education, and only that his organizations would be allowed to grant medical school license in the US. And that literally is how the medical model we have now started, because one man wanted to control it all. And know this: if you're taking a drug, you are reducing a symptom, but not actually healing the body. That all drugs really are chemicals that purposely are to get one result. They do this by overriding the body and they force it to do something. And I mean, that's why there's side effects. You are forcing the body to do something that it naturally wouldn't, and there's consequences because the body's always trying to put itself back into balance, back into homeostasis. And so you need to understand that all disease starts with inflammation, and inflammation is a reaction that the body has when trying to put itself in homeostasis against any toxin, any pathogen, any irritant. That's what I call toxins. They can be food, actual physical injury, heavy metals, heavy chemicals. These toxins create free radicals, which on a cellular level create damage. And then with enough injured cells, this is where inflammation starts to build up. Acute inflammation is characterized by redness, increased heat, swelling, pain, and impaired function. And that this happens because the actual blood vessels expand and become very active. They're trying to get blood flow to the area to handle it. Inflammation actually has, you can watch new blood and lymphatic vessels actually grow out of what the network that used to be there in order to try to recreate and heal the area. The interesting part I find is that while the activation of the actual blood vasculature can aggravate inflammation because you're bringing like too much blood flow to the area, and then that causes more fluid buildup, that the lymph vasculature that actually is being grown has only been shown to have beneficial effects in studies, because the lymphatic system actually clears out the excess fluid. So it's really blood flow and lymph flow have to really work together. And otherwise, you will get this swelling and all this pro-inflammatory cells and immune cells to the area, which you want for healing, but you also need to make sure that it moves out. So keeping the lymphatic system is really key in order to keep the inflammation down. An example of inflammation, acute inflammation, we can just see with the naked eye easily is the sprained ankle. A lot of people have had experience spraining their own ankle. And you have to think about when you actually twist that ankle that the ligaments get stretched. There's pain, swelling, heat. Obviously, it's pretty instantaneous, impaired function. And so, depending on how severe the injury is and how many blood vessels were actually broken, you may or may not see bruising. And so, whatever damage there is, white blood cells have to go to the area because there's not an infection yet, but the actual white blood cells will actually eat the damaged tissue, eat the damaged cells, and try to clean up the area. And over time, the body will heal itself. Acute inflammation is how your body will go in and fight infections and handle heavy metals and heavy chemicals as well. And this way, inflammation is good because it's how the body protects and heals itself. But when the inflammation gets turned up too high and lingers for too long, the immune system continues to bring all these white blood cells in, and all these chemical messengers actually can prolong it. And this is how acute inflammation becomes chronic. And you have too much going on in the area is not clearing itself out, and then the excess fluid builds up. And that fluid level creates too much pressure. That pressure gets put on a nerve, and then that's how you get chronic pain. Um, and a chronic pain, in a way, is just the tip of the iceberg. Like I said, I just explained all the steps that has to happen before you get to that chronic pain. So just so that you know, if you really want to truly heal an area, we have to hit all those steps, not just get rid of the pain. And that's how pain medication works. It just gets rid of that last piece of getting the inflammation off of the nerves, but it's not really truly healing the actual problem of why you had all that inflammation there to begin with. And so to prevent acute inflammation from actually becoming chronic, it all depends on the lymphatic system. We need to make sure that the fluid is balanced and all that excess fluid that's coming into the area also gets drained. And so you have to think of all those blood vessels being leaky and inflamed, and all that blood coming in, and the lymphatic system taking care of it. And so and this also goes for toxins. It's not just for fluid, it's not just for injury, but also if there's any toxins to the area, the lymph has to come through and remove the toxins. So lymph carries white blood cells. It also carries toxins. It actually carries digestion fat from the large intestine as well. It runs through the body in lymph vessels, like runs through the body through blood vessels. And the blood has a pump, it's the heart. The lymph actually doesn't have a pump. It goes up into the chest area. It gets dumped at the collarbone. It gets dumped back into the blood flow. From there, it makes its way up by getting pumped with every contraction of our regular muscles. And so that's one reason why exercise is so important, in order to move the lymph. If we're not exercising, we're not moving the lymph. And so the pressure gradients of fluid allow the leaked fluid from the blood to get absorbed by the lymph capillaries and then move through the body and eventually be pumped back into the bloodstream at the collarbone. The unfortunate part is chronic inflammation actually causes the lymphatic system to slow down, which in a way is good, because if there is any pathogen or toxin, the spread of it throughout the body is limited, but at the same time, the tissue is weakened and the inflammation intensifies. And so we have to be careful. And so, in getting the inflammation down, studies have shown that lymphatic vasculature plays a role in moving the fluid, moving the white blood cells, and actually allowing the body to heal. It helps when patients have psoriasis. It also helps rheumatoid arthritis, really any skin inflammation, not just psoriasis. And it's really good in irritable bowel disease. And helping support the lymphatic system is a big part of my job in the office. And there's actually lots of pictures. If you go to my website, on the testimonial page of where you can see people's skin changes, before and after pictures. And this is all in supporting the lymphatic system. But if I'm not going to muscle test you, in general, there's 4 top ways that I love to support the lymphatic system. First one is taking vitamin D. There's so many important reasons to take vitamin D, but actually to help support the lymphatic system is one of them. If you guys are up on reading about what to do with the coronavirus, people have seen that if you get the coronavirus, the tougher cases are people who also are low in vitamin D. Also, to help the lymphatic system, oil pulling, dry brushing, and I've already talked about exercise. So those are the 4 things: vitamin D, oil pulling, dry brushing, exercise. Excuse me. So oil pulling, I don't know if you guys have ever done it. You'd want to do it best on an empty stomach in the morning. You would actually pop in your mouth 1 to 1.5 spoonfuls of unrefined organic sesame seed oil, non-toasted. Sesame seed oil is the best oil to do this. Coconut oil would be the second best. You pop it in your mouth and you swish. Not vigorously like you would, mouthwash, but just kind of back and forth, pulsate it through, because for 15 to 20 minutes. Set the timer, because 5 minutes is going to go by and you're going to think it's forever. But you can pop it in your mouth before you even start taking a shower. Just like do your normal, regular routine. You just can't talk. And then once you're done swishing it, you would spit it out. I spit mine out in a toilet because I don't want to clog the sink. You could also do the trash can. And you would then go through and rinse your mouth with warm salt water, actually is best, and then brush your teeth, because you want to just keep pulling all those toxins out that you just pulled up and out. The lymphatic system is fat-based. It's oily, and the oil in your mouth attracts the toxins from the lymph. The lymph runs through your blood, or runs through your body, once every 7 minutes. So if you're in a hurry, at least do the full 7 minutes so you get the lymphatic system once. But I like the 20 minutes because it's almost 3 times. And so never swallow the oil. it's just loaded with bacteria, toxins, and things. And so just always try to spit it out. If you have a sensitive gag reflex, then do your best. 5 minutes would be better than none. And dry brushing is my second favorite thing. And you would actually it's called a dry brush, where you have a head about this big. Can you guys see? There you go. And it has a long handle, that way you can get the back of it. And you would preferably want to do this before a shower or bath, but any time of day is fine. And it's just because under the skin, there's so many blood vessels and capillaries and lymph nodes, and they just work so hard at circulating all of this. So this would help with circulation, not just for the lymph, but also for the blood. And you would start at your feet and legs with small strokes and kind of circular towards the heart. And so I don't do the face, but I start at my neck and go down to the heart. And you also want to make sure you get your back, so the back of the legs and the butt as well. And you want to concentrate, especially at the place where you have a lot of lymph nodes. The groin area, the armpits, the glands here as well. And every day would be good to do this. It also keeps the skin really nice and elastic. So if we're going to go back to chronic inflammation, you also need to know that weight plays a part into all of this. Excess weight and inflammation kind of go hand in hand. If you're overweight, you have inflammation. What's not clear yet actually is if excess weight leads to inflammation or if chronic inflammation leads to the excess weight. The verdict is still out, but what I do know is if I help people lose weight, it's because I'm addressing the chronic inflammation. Another way to address chronic inflammation actually is to have better stress management. Stress goes high, inflammation goes high. Chronic stress equals chronic inflammation. Cortisol is a big hormone that plays into all of this. It's the primary stress hormone that when it gets released, it increases your heart rate, blood pressure, it puts sugar into the bloodstream, it enhances the way that the brain uses the sugar and allows the cells to have it to repair tissue, which is all good things. But if stress continues for too long and the body can't keep up with making all of that cortisol, and so then the stressed body is asking for inflammation to occur. It's seen with chronic pain patients, chronic fatigue, fibromyalgia, any type of TMJ disorders, things like that. We want to do as much stress management as possible. And actually, studies have shown that the long-term cortisol levels actually break down the lymph vessels themselves. And so stress management is often overlooked in people's healing journeys. And there's so many different things that you can do for stress management. Sometimes I just have to ask patients, like, okay, what is it that you want to put into your daily life? And daily is the key word. A little bit every day before the stress even hits is ideal. And it could be journaling, it could be talking to a good friend, going to a therapist, mindfulness, visualizations, meditation, figuring out what relationships actually you need to stop investing in, which are healthy relationships you need to invest more in. And actually, when it comes to cortisol, research has shown that meditation reduces inflammation, and mindfulness actually modulates cortisol response in stressful situations. You won't get as much of a cortisol response if you're stressed out if you stick to mindfulness. Mindfulness includes observing, describing, acting with awareness, and accepting without judgment, which I know are all really hard things to do. But you might want to look more into that because it's a tool that we can use every moment and every day of our life. Mindfulness has also been shown to actually change gene expression. which is a whole nother topic, which I find fascinating. A book written by Bruce Lipton called Biology of Belief, where our thoughts and our really do affect what our genes, how our genes are expressed in our cells. That genes are not, written in stone, this is what our family genes are, but that gene expression can change based upon our thoughts because our thoughts do allow different hormones to be released. One of the things that actually works the best for me when I'm stressed and to actually change the physiological reaction that's going on in my body is to take 3 deep breaths. It almost sounds like too easy. But in the moment when you can just feel the stress going on in your body, just 3 deep breaths. And the breaths actually turn on the parasympathetic nervous system, which is part of the nervous system that's in charge of rest and digestion. When you turn on the parasympathetic nervous system with breath, you turn down the sympathetic nervous system, which is that fight or flight mode. And so breathing can get you out of that fight or flight mode and have less cortisol running through your body. And when I talk about deep breaths, I want you to use your diaphragm when you do it. We need to take all the steps we possibly can to lower the inflammation because research has shown chronic inflammation has so much to do with all different types of diseases: heart disease, diabetes, arthritis, cancer, bowel diseases. We don't want chronic inflammation to turn into anything. And at the same time, it's so tricky to deal with because it's not like we can run a lab test. It's not like we can actually see it unless there's the pain associated with it. It's kind of invisible. And so it doesn't have the telltale signs like acute inflammation does. And so, what's the best way to prevent or reduce the inflammation that you can't necessarily see or feel is really to get evaluated by your doctor. He or she will review your symptoms, perform a physical exam, um, and then the best approach is prevent conditions that will cause it. It goes back to the basics: maintaining a healthy weight, choosing a good diet, mindfulness, get plenty of sleep, meditation, and go back to your exercise. A diet and exercise, especially, have a strong impact on chronic inflammation because they control the weight and they improve sleep as well. And so, there is the anti-inflammatory diet evidence. When we study it, it's not very clear how if it really truly works. So in my world, there's no specific diet that can help prevent chronic inflammation. There are certain foods, however, that will either promote or inhibit the inflammatory response. Uh, Foods that are linked to a lower risk of problems related to chronic inflammation. And if you're not getting tested for your specific diet, then the easiest things to do is to eliminate foods high in simple sugars: soda, fruit juices, added sugars, sport drinks, also processed meat, refined carbohydrates, white flour, even whole wheat, pasta, pretzels, bagels. Any foods that will spike the blood sugar levels will increase inflammation. What you do want to eat more of is foods high in antioxidants. These known as polyphenols, if you want to get scientific, will lower the inflammation. Any type of berries, plums, red grapes, onions are really good. Green tea, if you're not caffeine sensitive. Dark green leafy vegetables, spinach, kale, turmeric. Okay, if you can think of any and every way to add turmeric into your diet, it would be great. It's one of the most anti-inflammatory foods. And if you also think of the green leafy vegetables as being alkaline, because lymph fluid actually should be 7.0 pH on the pH scale, so it's alkaline. The more acidic your body is, the slower the lymph flow will be. And so anything we can do to get the acidity down is really helpful for the lymph flow, for inflammation. And so Regular exercise is important. And it helps with obesity and heart disease as well. I thought it was interesting. A 2017 study found that just 20 minutes of moderate to intense exercise can have an anti-inflammatory effect. And so, come on, guys, we can definitely do 20 minutes. Start with 10 minutes, start somewhere, but don't feel like you have to have this whole hour-long thing. It's easy to do from home. There's lots of good online things now, too. And so, when I muscle test for actual supplements and anti-inflammatory, it's best to see what specifically works for you. But my top ones to share with you guys would be a turmeric supplement, magnesium supplement, boswellia, and oregano. Okay, and the turmeric spice contains actually what's in it that really helps with the inflammation is something called curcumin. It's a great anti-inflammatory. It works 10 times better with black pepper. So actually, if you're going to cook with it or put it in a smoothie, put it with black pepper. And if you're going to take it in supplement form, make sure that the supplement has black pepper in it too. And curcumin is really good for reducing inflammation on the brain, joints, and lungs. So I think we all need that right now. And the magnesium is another great supplement to reduce inflammation. It also helps with sleep, it helps with bowel movements, helps with so many different things. It's great. And boswellia is amazing. It's also known as frankincense at reducing inflammation. You can either get it in supplement form or actually as the essential oil. I love rubbing the oil on swollen and painful body parts, whether I just worked out or I'm been carrying the baby too long, or just general aches and pains. It helps support the movement of the lymph. So just one drop in your lotion on a daily basis, really good as an anti-cancer agent too. The skin, just frankincense is really good for the skin anti-aging. Oregano, I love. It can either be used as an oil or a supplement as well. It is so high in antioxidants, which is what we need to go after the free radicals with to reduce inflammation. It's also antifungal, antibacterial. So if you think your inflammation is due to any of those pathogens, it's perfect. Um, any mouth health concern can be helped with a drop of oregano, diluted in oil, or no, just do one drop of oil in water, swish it in your mouth, and actually swallow it. Don't swish it for 20 minutes, just really quickly. And, cook with oregano any chance you get. The fresh oregano really is the best. And so I don't know if you guys have heard about drinking celery juice, and I know it tends to be, or it seems like it could be a fad, but believe it or not, it's actually one of the health fads I agree in. I don't agree in many. And celery juice is really good at supporting the lymph, reducing inflammation in so many ways. It's really high in vitamin C, which is a really good, powerful antioxidant, helps fight invading germs as well. And if you think of we're helping support the blood, we're helping support the lymph, vitamin C is needed in the vessel wall. It's actually one of the things that keeps the integrity of the vessels and makes them stronger. And so then if you think about having stronger vessels, then there won't be as much leakage. And then the body won't hold so much water. And, water weight, fluid retention, celery juice is a great, if you think of it as a natural diuretic, helps get all that excess weight off. Celery juice is also high in potassium and sodium, which also work together to have good fluid balance and help stimulate urine production to get the water moving through the body. I don't ever feel like I have to urinate too much on celery juice. I feel like it just moves it through the way it needs to. And so I think that's about it. I hope that was enough for you guys. This is really, truly how I address chronic inflammation in my office. It's really about get rid of toxins, and with the right nutrition and less stress, the body can heal itself. Hope you guys enjoyed. Take care. Oh, okay. So Q&A. Allergic to celery, what is the second best option? Um, if you're not fruit sensitive, it would actually be cranberries. And cranberry juice is really, really tart. I've never juiced them myself. Actually, what's best, if you can handle it, would be buying a bag of organic cranberries at the grocery store. And we never think about sitting there and eating cranberries like we do blueberries because of the tartness. But if you can handle it, maybe just start with three, work your way up to a handful. Eat cranberries would be a second best way. Or you can go and buy cranberry juice without added sugar. And that's tart as well. You can also dilute it. That would be my second one from celery. What else? Okay. Do you brush your face as well? No, I tend not to. The skin is too sensitive. I don't want to ruin this. No. Start from your neck, start with the lymph nodes and down. And then for the face, when I put my facial oil on, I just massage it in a different way. There are great YouTube videos for actually massaging the lymph of just the face because we want to get this moving as well. But the dry brush, when you buy it, it's too strong for the face skin. So you want to start from the neck down. um, Thank you so much for all your comments. I see that this is really good. Okay, yes. So the supplements that I really like the most, if I'm not going to muscle test and we're just going to help support um, the lymphatic or the to get the inflammation down, is turmeric, oregano, boswellia, also known as frankincense, and magnesium. Those four. Okay. I hope you guys enjoyed. Take care. Bye.